Thank you, and good evening. Tonight, I welcome all of you to our Doctorate of Nursing Practice completion ceremony. It's a small group, but a very intimate group, and a group of 10 professional nurses and colleagues and friends who have accomplished a major feat. I want to start by saying on behalf of the college, on behalf of Angelo Aramo, our president, who is unable to attend tonight, that we are thrilled to have this wonderful group of graduates. Dr. Tasha Stanley is our provost. She's also not able to be here. She's with the president at a meeting. But I'm so delighted to have my friend and colleague, Dr. Nicholas Richardson, come up and say a few words. Nick is the vice provost of academic affairs. A provost is essentially a vice president, but Nick and Tasha together oversee the entire academic program. Essentially, he's my boss, but kind of like my boss under my real boss. But Nick, I'm so happy that you're here to say a few words.
Thank you so much for that introduction, Pat. It's great to see everyone here. This is a remarkable event. The DNP program is one of the newest degrees we have here at Wagner College, and to have 10 graduates here tonight, we're going to hear from, we're going to recognize them. It's just amazing. I just want to thank everyone who's in the room, family members, the students, but most importantly, the faculty who helped everyone get through this program. Dr. Ahern, Dr. Shrovsky, and Dr. Tucker. The nursing department, which is now the School of Nursing, the Evelyn Spiro School of Nursing, is one of the crown jewels of both Wagner College and Staten Island. It plays such a vital role in the community by providing healthcare providers that help everyone on Staten Island and the surrounding boroughs. It can't be overstated the importance that this school has on Staten Island. And it's the hard work of the faculty and the students and the families who support them that make this such a great school. And I think it's so wonderful we can come here tonight and celebrate the absolute pinnacle. The highest degree that Wagner College offers is the DNP degree. There is no higher degree, there's no parallel degree. It is the pinnacle of academic achievement at Wagner College. So we should congratulate everyone who's completed their doctorate tonight.
Thank you, Nick. Just a few things that I wanted to share with all of you before we start. Of course, welcome all, and as Nick just said, if it weren't for Dr. Ahern and Dr. Charovsky, we wouldn't have 10 graduates here tonight. But with that said, I also have Dr. Kathleen Falk that I would like to thank, Dr. Denise Gasselberty, Dr. Peggy Turgeson, and Dr. Lori DeSena that are all here tonight to celebrate with each and every one of you. Parents, children, spouses, siblings, friends, loved ones, babies, welcome. As I said, this is a very small but a very intimate program. And as Nick just said so beautifully, I'm glad I didn't say it, but I would have said that it's the best program. But we are the only doctoral program on Wagner's campus. We started this program about 2014 after much conversation and deliberation amongst myself, Dr. Ahern, Dr. Paula Trapello, and of course, Dr. Nancy Charovsky, that we felt we needed to better prepare our nursing students at the highest level to meet the needs of those that are most vulnerable, those in the communities that need our research, and the research getting into the communities faster than what it traditionally is. For folks that aren't fully aware of the terminal degree, this sounds deadly, but the terminal degree is really the highest degree that anyone would want to achieve, and that's a doctoral degree. And for nurses, we can do that in a variety of ways. We can do that with a PhD. We can seek out a DNS, a Doctor in Nursing Science. We can seek out an EDD, an educational doctorate. And now we have the DNP, and there's several more, but the DNP, or a doctoral level degree, is the highest. Of course, you can aspire to another one if you want, but we chose to do this and focus on population health, crisis management, emergency preparedness after several events throughout our careers and throughout our nation that really told us we need to do more. The events of a 9/11, a Superstorm Sandy, the Ebola crisis, the SARS crisis, the COVID, all of what comes on our doorsteps that we are not fully prepared for as we aren't in crises. So here we are, all these years later, now with the doctorate degree, and 10 students who have chosen to step up and do this incredible program. But I want to at least let you know why they did this, or so they may not know why they did this. The American Association of Colleges of Nursing, AACN, Big Brother that looks over us, tells us what we need to be doing, tells us, the educators, what we need to focus on. They were very clear in defining the role of individuals with the Doctor of Nursing Practice degree, the DNP, not the Doctor of Nurse Practitioner, the Doctor of Nursing Practice. This is a degree that, when it was endorsed, the DNP as a single entry degree for advanced practice nurses in 2004. AACN in 2004 endorsed this. And they did this because the association contended that the DNP is a practice-focused doctorate. Okay, practice, you're all practicing. That should prepare clinicians for leadership in evidence-based practice. Leadership in evidence-based practice. Now, we've had PhDs for a long, long time, and they typically take many, many, many years to accomplish. Meaning that all of that research that a PhD student is doing takes many, many, many years to hit the practice setting. And we all know in healthcare the practice setting is changing consistently. So the DNP is focused on research for practitioners to take their research and apply it into the practice setting faster, based on the evidence that we know, evidence-based practices. DNP prepared clinicians should be the best translators of research evidence into clinical practice and health policy to improve the quality and safety of care, as well as reduce healthcare costs through expertise in what we know as EBP, evidence-based practice. Change projects, EBP change projects, that's what you all did. Change projects, outcomes, management, and quality improvement projects. The United States invests billions of dollars a year in research, yet so little of it is translated properly and goes into the healthcare arena at the speed that we need it to. Many practices within the healthcare continue to be based on the tradition of PhDs. So research findings that do eventually make it into the real world practice often take years, and sometimes they're outdated. All my practitioners know what we did yesterday may be different tomorrow because it changes that quickly. Thus, there's an urgent need for DNP prepared individuals to speed this translation of research findings into practice and ultimately improve the health of those that need it most. For this to happen more quickly, DNP students must receive an education that prepares them to be the best translators of research evidence into clinical care, education, and health policy. So tonight you're going to hear from 10 students that each and every one created a research project. And this capstone project in DNP education must be focused on evidence-based practice. It must be a change project. It must provide quality improvement. And it must have outcomes focused on those that need it the most. It should also relate to healthcare policy. So Stephen R. Covey said, "To know but not to do is not to know." So I urge you, all 10 of you, to take the work that you did in these 2.5 years and implement it into the population of need. Do not let this work just sit on a shelf. Do not just write DNP after your name and feel proud after all you accomplished. The sole purpose of coming to our program and completing our program was to provide care to those that need it most with an evidence-based project that must reach the folks that need it most. We know what we know is the best evidence, and it must be quickly implemented into practice and policy. So tonight, not only do we congratulate our graduates, celebrate with them, we welcome them into the highest level of nursing at the DNP level, and we urge you to take your project and get it into those populations that need it most. Congratulations, we're so proud, and we consider you a Wagner alum again for some of you. And please, don't be strangers, continue to do the work that you do, and continue to stay connected with us. Congratulations. I'd like to now call Dr. Kathleen Ahern, our graduate program director, to the podium to say a few words.
Gee, that was so academic. I don't think I can really, but congratulations to all of you. I don't know what I'm going to do because for the last year, my husband knew all of your names. It'd say, "Oh, okay, you're going on a Zoom with that one." No, not really, but I'm just I'm so glad that all 10 of you are here tonight to finish. In the beginning, when I said 10 people, I said, I don't think, this is going to be very difficult, one of me and 10 of them. But, you all did it. So it's really wonderful. There's one of my favorite quotes. Actually, it's by Elizabeth Warren. I looked it up yesterday because I didn't want to use the quote if I didn't know where it came from, even though I've used it before. But it's that if you are not at the table, you may be on the menu. So I am going to improve on that a little bit. At least I think I am. I want to say, if there's no room at the table, pull up a chair for yourself. Make a place for yourself at the table. And to me, this is what this DNP is also about. It gives you entry to a lot of things. A lot of you may go on to jobs and roles that don't even exist. You're going to have to make it yourself, but you can do that. And if you do that, if you're at the table and it's not working, find another table. I've said this to you all a number of times. That's the wonderful, wonderful thing about nursing. We don't have to stay in a position that's not working for us. Maybe it'll work for somebody else, but maybe it's not working for you. Life is too short to spend so much of your work life at something that does not make you fulfilled, and it should make you happy. I've been here at Wagner a long time, but I won't tell you how many years because you'll start to figure out, boy, we didn't know she was that old. But, I love being here. We have so many good days, good years. You see the faculty I work with. I spent many years in CCU at Staten Island Hospital. Loved it. In fact, some mornings I'd walk in on a weekend with my friends and say, I can't believe I get paid to be here. It's so much fun. But anyway, so find something that you're really, a role that fits. The role of nursing is so broad. And now with that DNP, you really can make your own way and make your own place at the table. Congratulations.
Before I call each student to the podium, I would like to, Amy, Dr. Eshelman, wait 1 minute. I would like to acknowledge really one person who is the reason why all 10 students are here, at least 9 out of 10 of them. One did not need IRB approval, which is they need approval for their research before they can conduct the research. And the chairman of this department that oversees the IRB approval is called HERB, H-E-R-B, at Wagner. With her being the chairman, excuse me, the turnaround and the input and the real work that she puts into helping these students get their applications approved, I cannot thank you enough. I'd like all the students, you probably don't even know who she is. So this is Dr. Eschliman, and we cannot thank her enough. Without Dr. Eschliman, honestly, we would not have this program. And we really thank you very much. Really. Thank you so much. I'm glad I caught you before. Thank you both for coming. Thank you. Okay, so I'm going to start in alphabetical order. And I'd like to call up each student. And for about 5 minutes or less, they're going to explain the title of their projects. And they're also going to explain how they chose that project and where they see themselves in the future with this project. And all the work that they began here at Wagner to receive this Doctor of Nursing Practice degree. So with great pleasure, I call up first Minos Abraham.
Good evening, everyone. Respected teachers, dear friends, families, I cannot believe this is actually happening to me. Last 2 years have been extremely challenging, yet we all got through it. I really thank Dr. Ahern and all our teachers for holding our hands and bringing us all together to the end. The topic that I chose was about a complementary medicine technique, and the title was Reiki for nurses to calm and regroup during stressful situations. Why I chose this topic was a couple of things. First, there was not enough research done about Reiki, about Reiki in terms of healthcare professionals. That was one. Second, nursing profession on a usual day is a demanding job, whether it's like physical or mental exhaustion. And then comes along tornadoes, and then tsunamis, and then terrorist attacks, and then came along the COVID pandemic, which totally tested our patience. And I really wanted to do something, and me on the first hand itself, I experienced that mental exhaustion, especially during COVID, not only me and also my coworkers. And I really wanted to give a very cost-effective and very simple tool for them to help and regroup during the time of stress and stressful situation. So that was the second thing. And thirdly, I wanted to emphasize the fact that when there's an anxious situation or a depressive situation, the first thing we go to is to get medications, but we can always resort to complementary health techniques to help relax. What I will do with my project, in future, I'm planning to do my psychiatric NP, Master's in Psychiatric NP program. And I would like to utilize this on my patients. Also, I would like to use this on my colleagues in my department. I work in Staten Island University Hospital, Northside. I'm a stroke neurology nurse practitioner. And also, I have already put my intervention video on the YouTube, so you all are free and welcome to please watch that. I'm also planning to present at Northwell Health. They have a conference on alternative medicine, and I will be presenting there. And I have some more plans coming up, which I am not sure about it right now, so I'm not speaking. I will also reach out to NYPD, Fire Department, and Teachers Association, because I feel that their jobs are equally demanding as mine. So that's that. Thank you so much for hearing me out.
The next student I have the pleasure of calling up is Dana Goldie.
No, he said, it's okay. Hi, I'm Dana. I did my project on education for nurse practitioner students to increase screening and referrals for individuals that were exposed to the World Trade Center disaster. I chose this because a lot of people since that time have passed from exposure of the World Trade Center. And there are a lot of individuals who are walking around and they don't know that they have illnesses related to exposure. During my research, actually CDC predicted about 400,000 people that were exposed to the disaster. And there is a World Trade Center health program, and there's only 120,000 individuals that are participating, which means there are about 280,000 walking around, probably not realizing that they have some illnesses related. What I would like to do with this research program is I think it should be implemented in nursing curriculum to teach upcoming nurses to practice this in primary care. When I did the research project with nurse practitioner students, I found that a lot of the nurse practitioner students coming in didn't even know anything about illnesses related. So after I did the experiment, they realized that there's a lot to learn and that it is important to screen patients. That's pretty much it. I just want to thank Dr. Ahern, Dr. Sharofsky, of course. And if I'm leaving somebody out, I'm so sorry. Dr. Tooker, I'm sorry. And I also want to thank Kim, Kathy, Liz, Albina, Teddy, Minos, Michelle, and Lachana. Thank you so much.
The next student I would like to call up is Albina Guzman.
Hi, my name is Albina Guzman, and I did my project on self-image assessment tool for providers, patients who receive Botox and filler treatments. So why this project is important to me? Because I'm an owner of a practice, and we do Botox fillers, other injectables in my clinics, as well as hormone replacement therapy, IVs as well. So, and I see a lot of patients coming to me for those treatments, and I really wanted to know what really drives them to get those, cosmetic procedures. So my plans for the future, I'm planning to expand. I just signed a lease in Miami, so I'm planning to expand for my second office there. And my dream was always to become a professor one day. So hopefully one day I can share my knowledge of how to do the business, how to be an immigrant, and become successful. So I want to thank Dr. Ahern, who really took her patience with me. I know sometimes I wasn't easy, but I'm really grateful to her because she spent a lot of time on my project. And I want to thank Dr. Charovsky, who's been always with me since I came to nursing school in this, again, at this college, as well as my classmates. I don't know, I think without them, I definitely would be graduating because we helped each other, throughout those years. So, yeah. That's it.
Albina had a beautiful baby boy while she was completing the program. She looks amazing. The baby's only a few months old. Okay, I'd like to now please call up Elizabeth B. Harrington. Gotta get that B in.
What is it, Barbara? Is it Barbara? What does the B stand for? Brenda. Oh, Brenda. Hello. So, for those of you who don't know me, my name is Liz. I'm a nurse practitioner currently with Northwell Health. I've been there about 5 years now. I work in family practice. And my DNP project was on the implementation of a standards of care program for nurse practitioners to care for globally displaced populations in crisis. Globally displaced populations in crisis are defined as those who are migrants, refugees, internally displaced people, asylum seekers. Currently in the United States, we have 2,000 to 9,000 people crossing the southern border of the U.S. every day. These people are required to have health screenings between 30 and 90 days of arrival in the US. Unfortunately, because of COVID and flu and just endemic illnesses in general, these people will need care a lot sooner than 30 to 90 days. So I wanted to educate nurse practitioners because we are seeing these patients in our offices every day. I have seen many of these patients in my office, from Russian to Ukrainian to El Salvadorian. So many people who just really need that care. I wanted to do this project. I've always had a love for global health and public health. I've traveled now around the world, actually, some with Nancy and her family, and Teddy and Kim in Haiti. Been to Haiti, I've been to Mexico, and I do not plan on stopping anytime soon. But I will be stopping my degrees now. So Dr. Tooker told me she's going to kick me out now. I've actually been here. I did my bachelor's, master's, and my doctorate at Wagner. So I've been here too long. Going forward, I love my practice at Northwell Health. And I love my patients, and I'm not sure what I would do without them, and I don't really know what they would do without me either. So eventually, I would actually like to work for United Nations or the NIH, someone who can really globally assist different kinds of people from all over the world. So I want to thank, everyone, all of my amazing, wonderful classmates, Nancy, of course, Dr. Ahern, Dr. Falk, everyone who has assisted me from the time of bachelor's degree to doctoral degree. I would like to thank my parents, my sister, my wonderful boyfriend, who, if you see a man wandering around campus, flag him down. He'll be arriving shortly, who has just been absolutely so supportive and a beautiful addition to my life. So, yes. So, and Sammy, my dog, who has been, more of a therapy dog than really anything the past few years, and everyone in the room who loves and supports me. So thank you all so much.
I'd like to please now call up Dr. Kim Rodriguez-Loggins.
Hi, I want to thank my husband, first of all. I have a great husband.
Where is he?
He's all the way in the back. Baby, please stand. Just let them see. This man has supported me all the way through and through. You talk about, well, he's great. And my second mom and my second father that are here also, and I love you all, and I appreciate you, and even my family that's not here to support me today because of the time, it's 4 o'clock. I forgot that Dr. Turgeson was my teacher when I was in another school, and she kept telling me to go to Wagner. And I kept saying, but why? Is it better? She said, it's just different. So lo and behold, I took her advice, and I did my master's at Wagner College, and I'm here now doing my DNP. So thank you, Dr. Turgeson. I appreciate that, and I thank God I listened to you. When I started the DNP project, I kind of stumbled onto my topic because I did my first semester. The second semester, I lost my nephew tragically to gun violence. And I was going to drop out of the program. And as soon as I sent the email, Dr. Gassaberti, thank you, because she immediately called me. She said, what is going on? I know you. What is going on? And I told her I felt like I couldn't breathe. And of course, lo and behold, she reached out to Dr. Travasky, and they both supported me.
and I didn't miss a beat. I didn't drop the semester. I continued. Then I met Dr. Falk. And it was, where do you want to go with your focus for your project? And I said, I want to be able to screen kids that are at risk for violence against others or themselves. As healthcare providers, what can we do to stop it? It's just not writing us prescription. It's not. There's so much behavioral, social, environmental. There's so many different aspects to what we see in front of us. It's like an onion. As you get to know your patient, you start to peel them back, and you see so much more than this patient that's right in front of you. They have families, they have children, they suffered, they've endured, they've overcome. So that's what started giving me focus. And Dr. Falk had said, well, there's a screening that's out there called Adverse Childhood Experience Screening. So I kind of was quiet for a little while. So then I'm looking at my peers. I'm like, did you ever hear that? Did you ever hear that? And everybody works in different areas. And I'm like, wait a minute, we never heard of it, right, Kathy, Teddy, everybody, Liz? And she's like, well, there goes your topic. So it just started to snowball. And I began to just look at a lot of reviews, find out there was a landmark case that was done in 1998 that found that there was a connection to 9 of the 10 leading causes of death from toxic stress. So that's what blossomed into my project. And I don't even know how I'm here. I'm just grateful. Thank God. I have since just recently, the National Urban League wants me to go do a presentation for them. My church, I've already started doing a couple of presentations within the church. I don't know where it's going, but I know wherever it's going, it's good. And I trust that the same God that got me here will get me to the next chapter in my life. I want to thank Dr. Ahern. Saturdays, constantly back and forth with Zoom meetings and giving up her time so effortlessly. And Dr. Tucker, she gave me so many ideas, thank you, on the day of my defense. I appreciate all my peers. You guys are amazing. You all rock. Everybody's so different, but yet we're all so much the same. And I thank you. God bless you all. Thank you.
I'd like to now please call up Dr. Kathy Gale O'Connor.
One thing I will say is that I am the surprise graduate here. More times than I've written papers, I've said, I'm out of here and I'm done with this. And you all know it. So this is the biggest surprise, and hopefully this is the end of my education. I am maybe the senior person of this group. I've been at my institution for 34 years. I work at Memorial Sloan Kettering Cancer Center, and I now work in an outpatient oncology setting. And that's where my program topic of emergency evacuation of an outpatient oncology facility was born. I work in a glass building, and as we all know, this world is a crazy place between weather emergencies, nuts on the street, people who are shooting in school, shooting in healthcare, workplace violence is all terrifying. And institutions don't believe that it can happen to us. We all work somewhere and they say it will never happen here, but it will. It can. We just don't know, but we all need to be prepared. So oncology patients bring a whole constellation of issues with them: psychological, physical, neurological, emotional. And emergency preparedness, we need to be able to individually get ourselves out and safely get our patients out. So I did a program at a local outpatient facility on Long Island, associated with a New York City medical center. And I ran a skills drill. I did a video on how to get out of a fire situation, and how to help our patients be safe, how to triage them. And the staff all loved it. Initially, it was only for healthcare personnel, meaning nursing staff, and it wound up developing to the directors wanted everyone to participate. My next step, now that I'm retirable from my institution, being of age with a certain number of years, I may take my show on the road. So if anybody's looking for emergency evacuation planning for their institution, their clinic, I'm available. I'll give you all, as Wagner graduates, a discount. And I'll extend that to friends and family as well. I want the world to be a safer place. I want my colleagues to feel empowered to be able to get themselves and their families out of any kind of situation, whether it be at home, the local shopping center, the grocery store, or at work. I would like to thank all of you for helping me. The 9 of you are part of my heart forever. Dr. Ahern, Dr. Charovsky, I have no words. I wouldn't be up here without your coaching me and dragging me. I scared Dr. Chucker the first day she met me. I think I was the horror of her program. She was like, oh my God, the new face at the security gate. But thank you. I know. I'm the one non-Wagner person. Dr. Falk helped me through struggling through a project. Dr. Gesselberty, Dr. Corona, I don't see here. I thank you all. And I wish you all the very best. And please, stay in touch. We can do Wine Wednesday over Zoom. And thank you for drinking with me.
Kathy's been the matriarch of the student body, as you can see. She's got the softest, kindest heart, for sure. I'd like to now please call up Lashana Pereira, Dr. Lashana Pereira.
Hi, I'm Luciana Pereira. Thank you all for coming this evening. So my project is about an educational program for healthcare providers to increase knowledge of barriers to screening for cervical cancer among South Asian and Southeast Asian American women. So some of the South Asian countries are Sri Lanka, India, Pakistan, and Nepal. There's many countries, these are few of them. And some of the Southeast Asian countries are Thailand, Vietnam, Indonesia, and Malaysia. So why I choose this topic? So I chose it, the cervical cancer screening among Southeast Asian and South Asian women for 2 reasons. First, I'm a South Asian. I'm from Sri Lanka, and it's a small island next to India. According to the World Health Organization, cervical cancer is the 4th global cancer in women. South Asian and Southeast Asian American women have the lowest rate for cervical cancer screening among all minority living in America. I found in my studies that women from these regions do not attend annual pap smear tests due to many barriers. So these include cultural barriers such as their beliefs and values in the culture, and lack of acculturation, modesty, low health literacy, and low socioeconomic status. So out of all these barriers, the modesty is the major barrier. So these women are embarrassed to expose their body during physical exams. So my goal was to find out what literature suggests to overcome these barriers. So in the literature, I found that the availability of female practitioners, access to bilingual health practitioners, and use of appropriate drapes to cover their bodies, and allowing adult female to accompany during the procedure will help them to overcome these barriers. And my future plan for this project is to bring this information to the South Asian and Southeast Asian community. So I live in a large Sri Lankan community. So there's close to 300 women attend the same Buddhist temple that I go. So I'm planning to educate them. And when I see them in the community, I always ask them, because I work in Richmond University Medical Center in Mother Baby Unit. So always the ladies in the community reach out to me because last time they happened to go to a doctor to do their GYN care. It was like last time when they had a baby. And there's like 15, 16 years past, their children are already out of college and they still didn't go to GYN care. So these ladies have hysterectomies and a lot of fibroids, and they had like a lot of hemorrhages going on. So I always, when I see them, the first question I ask them, did you go for your annual physical, screening? And then I happen to find like, no, because they don't want to embarrass, they are very embarrassed. They don't want to expose their body. So this project is very important to me, so I could bring this to the community and educate them about this. So my future plan is to that if I could publish this in a peer-reviewed journal and speak to a conference about it. And also I'm going to teach in Wagner College soon. Yeah, so that was as a clinical instructor. And yeah, I would like to thank Dr. Ahan, and I may be the most difficult students for Dr. Ahan.
Definitely not.
No. So Dr. Ahan has to repeat a couple of times same instructions for me. Look, Charlie, not this way. So I drive her crazy. And then Dr. Nancy, I know her since FNP program, and yeah, long time. And I want to thank Dr. Glasaberti, and she took a lot of time, correcting my paper, and she spent a lot of time suggesting, and I should, fix my paper this way. And we went through so many, during office hours, she spent a lot of time with me, and I want to be very thankful, sincerely from my heart. Thank you, Dr. Glasaberti. And Dr. Falk, thank you so much, and giving me all the ideas that how could I improve my paper. And Dr. Tucker, thank you so much. And yeah, you're a wonderful person, and you teach our finance class, and I felt we were first afraid to you, and then we found and how cool you are. Yeah, you were amazing with Dr. Messina. He's our CEO in our hospital, and me and Michelle, we both work in Richmond University. We were so nervous, but like Dr. Tucker, took care of us in there, and yeah. And of course, Dr. DeFazio and Dr. Trevisan and what is the other? Dr. DeSanz, and I'm sorry that DeSana, yeah, okay. So thank you so much, all the teachers that helped me to get through the DNP program. And also I want to mention my family is my father and my husband and my 3 beautiful daughters are here. And they supported me a lot, and my husband helped me a lot to, do the Poton video and print out my book, and he's a graphic designer. So yeah, it was a lot of help from him. And also in my wonderful daughter, Samadhi, and she's a freshman in Wagner College, and she's going for nursing, and she is my, proofreader of my papers since I was doing FNP, and she helped me all upload my videos to YouTube and in my Poton video, and I don't know how I'm gonna do it without my husband and my daughter. They helped me a lot, and they gave me a lot of support. And my Pooja and my Netra, and I love you all so much. And my mom is in Sri Lanka right now. We have one of the weddings, the family wedding, so she couldn't be here, but she's so proud of me. And thank you so much for my father and mother and my husband and my 3 beautiful children and all the teachers. Thank you so much. And my beautiful colleagues, all 9 of you. helped me a lot. And I don't know, I was a shy one, and they always encouraged me and write lists. Like I was so afraid to go and present for the FNP students. And she said, "Oh, Chana, if you can assist in delivering babies, you can go for. You only had to speak in front of the FNP students." So all my colleagues gave me a lot of encouragement that I can do it. And I thank you so much. Thank you, ladies, and thank you, Teddy. Thank you.
Hopefully all three of Lashana's girls will think about nursing, right? No. I'd like to now please introduce Dr. Elizabeth Jessica Ranelli, please.
Hi, everyone. I'm Liz. I'm an aesthetic dermatology nurse practitioner, and I'd like to thank the faculty at Wagner College, as well as our family and friends, as well as our cohort for supporting us and getting us through this program. Thank you. I'd also like to thank Dr. Sharovsky, Dr. Ahern, Dr. Turgensen is somewhere. Oh, there she is. And Dr. Tucker for attending my defense proposal. I'm very appreciative for you guys taking the time out of your day to come and help me get where I am to today. I did my project on an education program to improve the FNP student knowledge of melanoma for early detection as well as diagnosis. When I was obtaining my master's to become a nurse practitioner, I noticed that there was a lack of knowledge in dermatology. If you look at a lesion, especially if you are a student, all lesions kind of look the same, whether it's cancerous versus non-cancerous. And then when I sat for my boards was very derm heavy, as well as my first question was melanoma of the fingernails. So there's room for knowledge for providers. Primary care providers are the first line of defense for melanoma screening. And the thing is, if I notice a lesion and I might think it's funny and refer you to a dermatologist, the wait times for dermatologist's office can be months. So sometimes patients don't go to attend these appointments, and there's actually a rise in deaths for melanoma, which is unfortunate because melanoma is curable. So I wanted to prevent this from occurring, so I developed this information program for students, and it worked really well. The students loved it. I attend many professional conferences throughout the years. One of them is the International Society of Plastics and Aesthetic Nursing. So I will be submitting my video to see if I can present at the next conference next year, which is in Dallas, as well as Dr. Ahern is helping me to submit this research program to the Plastic Surgery Nursing Journal. Thank you.
I'd like to now call up our only male student in the group who we all love. He's been at Wagner for quite a while now, and we're very thankful for that. Dr. Teddy Theodorakis. Did I get that right? Yes.
Hello, everyone. Okay, so my project is the prophylactic administration of povidone iodine intranasally, preoperatively in elective total knee replacements as effective as MRSA prophylactic screening and mupirocin treatment in a retrospective analysis. I transitioned from a pain management role into an orthopedic role after COVID. And while surgical site infections are unfortunate and happen, there seemed to be an uptick at our facility, especially with this bacteria, MRSA, or methicillin-resistant Staph aureus. And because of COVID, the way we treat and decolonize for this changed from just testing for the patient and applying mupirocin, which works much better, we found with research, than just prophylactically putting iodine in the patient's nose and then going to surgery. So we, with my mentor, Deirdre O'Flaherty, we looked over the infections in the hospital and analyzed both therapies and found mupirocin works better for treatment. And where we look to go through with this project is we're working towards publication with the National Association of Orthopedic Nursing, and hopefully to influence the facility to change their decolonization practices. If it's not MRSA swabbing, to just at least test the patients who are high risk. I didn't get to this point alone. I want to thank everyone that got me here. Thank God. I want to thank Dr. Sharovsky, Dr. Ahern, Dr. Falk, Turgison, Dr. Kesselberti, Dr. DeSena. I want to thank my family and all my colleagues for their direct and indirect support. This was not easy at all. And no, thank you.
The final student I would like to call up is Dr. Michelle Torres.
Good evening, everyone. My topic is on a culturally sensitive educational program for family nurse practitioner students to improve vaccination completion within the Latinx population. I chose this topic because vaccines save millions of lives each year. The Latinx population, which represents a diverse group of individuals such as Mexican, Guatemalan, and other Latin American countries, are affected by differences in attitudes towards vaccines and facing cultural disparities such as their primary language, lack of health insurance, education, and costs. In the maternal child care area where I work, the majority of the Latinx individuals who are my patients, I would offer them vaccines, and many of them will tell me they have no prior knowledge of vaccine information and were unwilling to get vaccinated. So by me being there and speaking and being bilingual, I'm able to explain to them. And they'll tell me, they thank me so much for helping them understand vaccines. I have found in my research, miscommunication between healthcare providers and patients are due to differences in language and low English proficiency, which are impediments to getting vaccinated. The Latinx population are susceptible to poor health literacy and are unable to understand and use medical information that can affect access to and use of the healthcare system. It is estimated that 42% of the Latinx population in the U.S. have low literacy levels. Healthcare systems are not adequately prepared to communicate with individuals who have low literacy levels. Healthcare providers can incorporate effective communication strategies, such as easily understood vaccine education into their practices without the difficult medical terminology used to confuse them. I plan to work within communities where the Latinx population can have access to and understand information necessary to make informed decisions on getting vaccinated for themselves and their family. I would like to thank Dr. Sharovsky, Dr. Ahern, Dr. Falk, Dr. Ticker, everybody. And my family, I love you guys. Thank you.
Would anyone just like to take a break, or we'll just continue? Because the next step would be to hand out the completion certificates to each student. We're okay? Everybody good? Okay, good. Okay, good.
I just want to congratulate all of you again and pass this back over to Dr. Charovsky when we do the presentation of the completion certificates. It's just a wonderful night, and we're all just so very, very proud of you. I also failed to recognize my dear friend and colleague who slipped in without me seeing her, Dr. Jane DeFazio in the back, who I know you all know and love and has taught you in some of our classes. But thank you all again for coming. I'll turn it back over. I feel like the mom who is seeing 10 of her children walk across the stage. It's just an incredible time of year when we see the accomplishments. Some of the disappointments as well that we've been dealing with over the last few days, obviously with undergrads and grads. But thank you for choosing Wagner. Thank you for staying true to the profession. Thank you for finishing your DNP. And please, please take this work that you've done and go further. Thank you all. Nancy?
I would just like to also thank all of you for just being an incredible group. Gonna miss you. Yeah. Please, as you go further, stay in touch. We want to hear all the good things that you're doing, whether it's passing another certification exam, going into another program, taking a new job, just something that's really important in your life. We would like you to stay in contact and you can contact me because then I'll make sure it gets out to everyone. So please, stay in touch with us as much as you can, okay? So I'm gonna do the completion certificates. This is their completion ceremony tonight. They have completed the, for the most part, they have a few more things to do, some of them for me, by Sunday night, which they'll do. So if you see them busy this weekend, please let them stay busy because we have to be done by Sunday. This completion ceremony states that they completed all their courses and their coursework. But come May at the college, they'll have a graduation, a doctoral graduation where they'll be hooded. It's a traditional ceremony. It's a really nice ceremony. I really encourage all of you to be there. It's where you'll go up on the stage. The doctoral students usually go first, in the graduation before the other cohorts. And you'll be hooded, usually by Dean Tooker. I believe she'll be hooding you. I'm sorry? Yeah, it really is this is beautiful because your families can be here and it's intimate, but you also can be there in May and have this traditional hooding ceremony with your gowns. And I know my gown I keep in a plastic bag and I only get to wear it once a year during graduation and I love it. And you'll see the different professors that have their doctorates. My friend Jane has her doctorate, and Peggy and Denise and Lori, we all have different doctorates and our gowns are different from the institutions that we went to, the different colors. So you'll see that and it's just nice. So please come back. Okay, so I'm going to start with handing out the completion certificates. I'm also going to hand you an invitation just in case you keep mementos. I know when I was a little kid, I had one of those boxes that we would put everything in. I forget the name of it. What's the name of that box? Shadow box. Yes. I would love to drag mine out, but I would put everything in there. So keep your official's invitation. Please keep, of course, your certificate, put it up on the wall. Be proud of this doctoral degree that you took so much time away from your family and loved ones to receive, but you all deserve it. So thank you for everything. So, thank you. Okay, so I'd like to first please call up Dr. Minos Abraham. I'd like to please call up Dr. Dana Goldie. I'm not saying your name. The next doctoral student I'd like to call up is Dr. Albina Guzman. The next doctoral student, graduate, what am I talking about? Dr. Elizabeth Harrington. Okay. Dr. Kim Rodriguez Loggins, please. Thank you so much. Dr. Catherine Gale O'Connor. Dr. Lashana Pereira. Dr. Elizabeth Jessica Ranelli. Dr. Teddy Theodorakis. And last but not least, Dr. Michelle Torres. This completes our ceremony. We'd like to really thank everyone that attended. We know that you're here to support your family member who, again, deserves every bit of support and love and the best to all of you always, okay? So again, please stay in touch and don't leave. We still have plenty of wine and we have cookies and stuff, so
That's all for
please.
the faculty.
Yes,
I'm sorry.
please help yourself.
I also would like to tell everyone, if you would like a private picture or a few pictures, our photographer is still here, perhaps here in the lobby. In the lobby, if you would like some family pictures or group pictures or whatever you want. But please partake in some of the remaining snacks, and thank you and congratulations.
Up on the website, right?
And the video will be up on the website shortly. Thank you to our video staff and our photographer. Thank you very much. Good night, everyone.